Hello, my name is Eric Dixon and I'm the President and CEO of UMass Memorial Healthcare. And welcome to the UMass Memorial DCU Center Field Hospital. The UMass Memorial DCU Center Field Hospital is a creation of a partnership between the state of Massachusetts, the city of Worcester, and UMass Memorial Healthcare. It's also been created in partnership with our friends at St. Vincent's Hospital. Just 1 week ago, this was 50,000 square feet of empty space. And now it's a 216-bed field hospital designed specifically for the care of patients with COVID-19. I'm going to introduce you to the stars of today's show, the people that will be operating this field hospital. Pete Lancet, our Executive Director here of the field hospital. John Broach, our Chief of Disaster Medicine and Medical Director of the field hospital, and Sharon Rudnitsky, our Nurse Manager here. This hospital will be opening on April 9th at 7 o'clock in the morning, just 8 days after we started the work here.
Each one of us is going to be required to wear a gown the entire time that we're here. We'll need to be wearing an N95 mask or a PAPR unit for our respiratory protection. We'll also need to protect our eyes, so we'll either wearing face shields or we'll be wearing a pair of goggles. And then, of course, we all have to wear gloves.
This is our intensive care area. This would be for patients who were on the floor in a regular COVID bed, decompensated for whatever reason, and need more critical care resuscitation acutely. We've got all the equipment, the key equipment that would be in a regular ICU, infusion pumps, code cart, cardiac monitor, ventilator, and we'll have the staff here to be able to perform intubation and other critical airway maneuvers here if we need to.
This is one of our standard med-surg level of care patient rooms. We do have power to each bed, so patients will be able to charge their phones. We're providing tablets for patients. They'll be able to access social media and be able to communicate with their families and friends. And we're also going to be recognizing that we're going to be caring for patients with a variety of language needs. So we brought in these mobile interpreter services, iPads, so that patients will be able to communicate in their native language. We have brought in supplemental bathroom facilities for the patients. They are ADA compliant, they have ramps. To our left here, we also have shower units that was brought in. This is an example of our mobile workstation on wheel. We call them WOWs. Our IT department was able to build out Epic, and we will be using these WOWs to document on patients as if they were in our fixed facility at UMass University or Memorial Hospital. So we're just going to show you some of the technology that we brought into the field hospital. We have a vein finder which will help initiating IVs. We have a nurse call system, which each patient will wear a pendant and they'll be able to push the button and it'll alarm to their nurse that they need assistance. We have finger stick glucometry we can do here, and we have iStats point of care testings that we can run ABGs and blood chemistries on. Right here we have our physician documenting stations. It's right in the patient care area. We have these desktops set up that the physicians can sit down and document the care that they're providing. We have a portable x-ray machine that we will schedule x-rays at least once a day for these patients and do them as needed.
There's not a lot of medications that we use beyond oxygen to treat patients with COVID disease, but a lot of these patients have daily medications that they take, and those will have to continue here. So we have our Pyxis machines where the nurses can come, punch in the patient's name, and assure that we're getting the right medication to the patient. On behalf of the entire team here at the DCU Center Field Hospital, we want to thank you for your support and the work you're doing to help stop the spread of coronavirus by keeping a mask on at all times, keeping social distancing, by washing your hands as often as you can, and by not touching your face. You're helping us save lives. I also want to thank all of our caregivers at UMass Memorial Healthcare, both clinical and non-clinical, for their tremendous dedication to our patients and our communities. Thank you.